So the thing that I'm gonna discuss today is ADHD. So ADHD is a big chapter, but I want to make a quick revision of it. So first of all, if I just want to define ADHD, the name itself tells ADHD means attention deficit hyperactivity disorder. So that means there are three important things will be here. One is attention deficit, that is inattention. Then hyperactivity, that means the patient will be hyper, and the third one is impulsivity. So inattention, that is attention deficit, hyperactivity, second most important thing, and the third one is impulsivity. So impulsivity means patients like they are too much impulsive, like say they say for example in the classroom they just try to answer the questions even before listening the questions. So that's kind of thing that we call impulsivity. So if I just talk about the percent wise, not all the patients will have all these three things together. There should be a blending. However, most of the cases we see like 70% of the patient comes with a hyperactivity thing, not 70 to 80% to be very exact, and inattention is like 10 to 20%, and impulsivity is really less, like 5 to 10% of the patient may consider that impulsivity thing. So if we just talk about the pathophysiology of this thing of the ADHD, in that case two things comes in the place. It's all basically the neurotransmitter thing. There are different hypotheses, but the bottom of every hypothesis comes with the neurotransmitter thing. So the decreased level of norepinephrine and the decreased level of dopamine is mainly responsible for ADHD development. And the thing is that if people wants to diagnose, it's not the responsibility of a pharmacist. The thing is mainly diagnosed by the psychiatrist because it's under their banner. But still, as a pharmacist, if we need to know something little, it is DSM-5. It's kind of a big guideline based on which the psychiatrist define it is it is a ADHD or it is something different. So just a little note, like there are few things we can remember from that guideline, not for the full diagnosis. There is a magic number called 666. 6 means for every aspect of this ADHD, like that inattention or the hyperactivity or the impulsivity, there are a list of symptoms. So if the patient comes with at least 6 of these symptoms and these symptoms persist for 6 months, that means that patient might have that specific feature. So for example, to be qualified as a patient with inattention, there must be 10 criteria. I'm not sure how many counts, I didn't read that. So out of 10, if the patient shows like 6, that means he or she is qualified into that points. And on top of that, symptoms should be there at least for 6 months. So 6 points, 6 months, that means he or she is qualifying that points. So it is true for inattention, it is true for hyperactivity, it is true for impulsivity. And finally, the third 6, we call it 666. The third 6 is basically referred to the age. So like if patients wants to start medication, if it is a pharmacological medications, the age limit should be 6. It is not related to the diagnosis level, but it is just kind of a magic number to remember some shortcut things in your study. So 666 means 6 points, at least 6 months. You can start the medication, the pharmacological one, if the patient is 6 years of age. So that's the significance of 666. I'm not going to go into that DSM-5 criteria because that's not my role, because I want to be a pharmacist, not a physician. Let's come to the goal of therapy. So goal of therapy is basically to improve the quality of life for sure. Like the patient are so much active, so much inattentive, and so much impulsive that it's really difficult to cope up in the social life. In the academic settings, they are kind of different than other kids, and kind of a messed up situation. So the goal of the medication is to reduce or eliminate that ADHD symptom, and also improve that academic performance, or performance means like their ability to run smoothly in those environments. That's quite important thing. And social functioning, although it's not possible to improve that social functioning in a full swing, like not 100% possible to restore that social functioning, but at least that medication can help to reduce the symptoms, some basic symptoms of ADHD, and also can help the patient to cooperate or collaborate in the occupational or academic settings. And that quality of life and self-esteem improvement is ultimately the big umbrella kind of thing. And also the drugs that we're going to use, I mean the pharmacological drugs that are kind of having lots of side effects, so it's always better to minimize the side effects that we are having to see from the drug. So now if we just talk about the therapy, there are two kinds of therapy. The first one comes the non-pharmacological therapy, and the second one I talk about the pharmacological therapy, and the second one I'll talk about later. The first one is pretty straightforward. It is kind of behavioral therapy, that means cognitive function improvement kind of thing. So it's basically the CBT, it's basically the exercise and physical activity, also practicing the right sleep hygiene, mindfulness and relaxation kind of thing, dietary modification. It has been proven in some clinical trials that reduction of sugar might help in some symptoms of ADHD. So I'm not sure, I didn't check that trial, but I'm just telling you. So CBT, so exercise, CBT, mindfulness, diet, sleep habit, this kind of things are the non-pharmacological things. This will help for sure, but not as helpful as the pharmacological, I guess. So pharmacological treatment, there are different class. The main class that always comes in our mind is that stimulant. Second one is we call norepinephrine reuptake inhibitor. Third one we call alpha 2 adrenergic agonist. There are also some antidepressant, some antipsychotic, some natural. There are lots of class. Better we studied pharmacotherapy, I mean pharmacological treatment options in a different way. Let's talk about the first line. Like if we just talk about the first line, second line, third line, that's gonna be easy, because class wise there are so many class, so many drugs, but actually in practice when I talk about first line, second line, third line, only a couple of drugs comes there. So first line drugs, I mean for the patients with ADHD, the first line is long acting stimulant. Stimulant, long acting. So that means there should be something stimulant with short acting or intermediate acting. That's true. So long acting stimulants are considered as the first line therapy, and within this long acting stimulant therapy, I mean it is long or short, there are two classes. One is amphetamine based and the second one is methylphenidate based. So amphetamine based, in Canada we have seen many medications, but the most popular one that we have seen is like what you call Adderall XR, the Vyvanse. These are the things that we have seen. So amphetamine based psychostimulants, let's talk about these things first. So they have Adderall XR, it's a capsule thing. They also have Vyvanse, that is also kind of a capsule and chewable tablets. I have seen a lot of strengths of Vyvanse, 30, 40, blah blah blah, and patients are taking every day. They're taking every day. Like there are a lot of dispensing happening from the pharmacy. So I guess like ADHD patients are a lot in Canada. So Vyvanse capsules and chewable tablets, those are available. And the third one is Dexedrine. So Dexedrine is basically, these all three are amphetamine based psychostimulants. The first one, that is Adderall XR, we call it mixed salt Adderall. So it is basically the amphetamine salt and it's mixed format thake. So it's in the mixed form. So IRDA ratio, that's important point, like which one is the best one, which one is the good one. Either it is the amphetamine based or or it's a methylphenidate based. You have to depend on a couple of things. Number one, How about the duration? For sure, if it is long duration, then it's the first line. If it is short duration, it's the second line. Second most important thing, what is the duration of action? If it is long duration of action, that means it's long acting, so it's gonna help you to adhere the medication. It will help you to settle the patients with uh, better medication practice. Like they don't have to have some short-term medications in the school because they have taken the long-term, long-acting one. So these are some benefits of that thing. And another important feature is that release pattern, IR-DR ratio we call it. IR means immediate release, DR means delayed release. So IR-DR ratio is kind of an interesting thing. So for example, Adderall, we have a 50-50 IR-DR ratio. So mixed salt Adderall, which is uh, amphetamine, mixed salt amphetamine, that has a 50-50 IR-DR ratio. That means 50% of the granules can be considered as immediate release, and the rest 50% they are actually delayed release. So that IR thing, that will start working right away, and that not right away, but it will absorb faster, and then that delayed release thing, that will keep doing their things for the long run. So that's the IR-DR ratio. So uh, Adderall and Vyvanse, they are both kind of long acting thing because they are acting like more than 12 hours. They both are similar, like 12 hours. Vyvanse is a bit different because it's a prodrug. It's called lisdexamfetamine. So the patient sometimes call, like, I got a text that my meds are ready. It says something with lis is ready to pick up. So lis, actually they don't know the full name of that Vyvanse. It's basically the Vyvanse is ready for their delivery. So say for example, at some pharmacy they send a text to the patients and telling that your medication starts with lis is ready for pickup. So that means the medication lisdexamfetamine is ready for pickup. So sometimes they say, oh, it's Vyvanse, but I saw it's lis. Then I should see it is lisdexamfetamine. So that's the short form that you got in the text. So it doesn't matter, name doesn't matter, patient knows Vyvanse, that's good. Now the third thing of the amphetamine based psychostimulant. So third thing is that dexedrine. It's not that popular, that's because it is short acting. Secondly, uh, I mean the first one is really better. I mean the long acting one, that Vyvanse and error is so much. Practically, I work in a pharmacy, so practically what I see, like most of the patients, if it is amphetamine based, I see a lot of Vyvanse. Some cases I see Adderall, but I have never seen that dexedrine thing yet. So dexedrine, it has tablet and capsule. So capsule means they have a benefit. So capsule has an extra benefit, like capsule you can uncap and you can sprinkle the materials. Say the patient cannot swallow the pill or the tablet, so if it is a capsule thing, you can sprinkle over food and the patient can take it without any issues. So that's a good point. And the Vyvanse, they also have the same benefit, Adderall, Alexa, that 50-50 mixed salt IR-DR ratio, that is also in the same way. But the dexedrine, they have both tablet and spancel, I mean that granule kind of thing, but it's not that long duration of action, and also that IR-DR ratio is not satisfactory. Like if it is a tablet, it's 100% IR and there is nothing, I mean there is no delayed release, it's instantly released. And if it is the capsule format, I mean that spancels are there, then it means 50-50 release pattern. I mean 50% is released like immediate and 50% delayed. Now let's go to the methylphenidate psychostimulant. Among these two types, like the amphetamine based and the methylphenidate based, practically I see like 50-50. A lot of patients they are on Vyvanse, and there are also a lot of patients on methylphenidate based treatment, like the Concerta, like the bifenthrin. Most frequent that I found here in Canada, that I have seen here in my pharmacy, is the Concerta. So these are totally different thing. The first three things are like the amphetamine based, and these are, now we're talking about methylphenidate based. So these are the methylphenidate based stimulant. So the first one comes bifenthrin. It's kind of a capsule. So when it's capsule, so that means it can be, granules can be sprinkled, and it's a long duration, so up to 12 hours of work activity. and the IRDA ratio is 40/60. 40/60. So for bifenthrin it is 40/60. The second one is Concerta. Concerta is kind of a different formulation. Different formulation, like it's not the typical capsule or not the typical tablet. It's kind of a, we call it OROS, osmotic controlled release oral delivery system. So if you ever worked in a pharmacy, or if you're working in a pharmacy, you will see that Concerta looks like kind of bullet shaped. Not actually bullet shaped, it's kind of a cylindrical thing and quite heavy. It's really tough to count because that thing, I don't know why, somehow they attract that spatula for counting. So it's kind of a different thing, very hard, you cannot crush it. So the biggest benefit of not being crushed is like it's safe from that abuse liabilities. Like patient cannot break it and remove the powder out of it and then use it for abuses purpose. They can't do it. That's because it is prepared that way. But one of the bad side is that if the patient is having some kind of obstruction in the intestine, so it's going to be a problem for them, because maybe it will be stuck there. So the patients with GI blockade or the narrowing GI pipe, usually it is not given. For them, they have other options like the bifenthrin or the Foquest or the many other things they have. So safety wise, like abuse liability wise, I would say Concerta is the better one, and it also has a it also has a ratio, like duration wise they all are like more than 12 hours, and that IRDA ratio is, it is 22/78. That means 20% IR, 22% IR, and 78% is DR. Now if I talk about the best of the best, to me, it's my personal opinion, is the Focused. Why the Focused is the best of the best? That's because it is granules, although it has the issue of liability, like the dependence liability, not the dependence, abuse liability. Patient may abuse it, that's one point, but other than that, efficacy wise it is 20/80, so 20% IR and 20% 80% DR. So that's a good part, and it works like more than around 60 hours, so that's a very good thing. So I call it the best of the best, although it is not something very technologically advanced like the Concerta, but it's kind of a performance wise, it's a good one. And the last one in that methylphenidate based therapy, we have Ritalin. Ritalin is basically the brand name. There are some generic versions are available. So it's basically the methylphenidate, either for